Number 1. Bariatric surgery for control of diabetes.
The number of diabetes cases in the U.S. has tripled in the past 30 years to more than 20 million. And more than 90% of these people have type 2 diabetes. Type 2 diabetes develops when the delicate glucose balancing system is disrupted, most often because of obesity. 70% of adults in the U.S. are either overweight or obese, and so are 1/3 of children and teens. Many physicians performing bariatric surgery have found that these procedures would rid patients of type 2 diabetes, oftentimes before the patient left the hospital. In 2012, the New England Journal of Medicine published results of a study of 150 patients with type 2 diabetes and obesity who had either bariatric surgery or counseling and medication as treatment. The study results astounded the medical world, leaving readers thinking, a cure for type 2 diabetes? Compared with patients taking diabetes medication and receiving lifestyle counseling, those who had bariatric surgery were far more likely to be free of diabetes. Bariatric surgery also helping many to lower blood pressure and cholesterol.
It was 49% of those 60 patients that met goal.
Research body mass.
The JAMA Network.
For many obese patients, one of the criteria for undergoing bariatric surgery is having a body mass index or BMI of 35 and above.
In the United States, patients get type 2 diabetes on average at a body mass index of 31.
Dr. Saeed Akramuddin from the University of Minnesota and co-authors randomized 120 patients with poorly controlled type 2 diabetes and who were moderately obese, with an average BMI of 34. All patients received lifestyle counseling, advice about weight loss, and cholesterol and blood pressure lowering medications. In addition, 60 patients were randomized to receive Roux-en-Y gastric bypass surgery. All patients were followed for 1 year.
The medical group lost between 7 and 8% of their total body weight, and the surgical group lost around 26 to 27% of their weight.
The study appears in JAMA, Journal of the American Medical Association.
This surgery needs to be used as a tool to help people get to goal.
The American Diabetes Association recommends the treatment goal for controlling type 2 diabetes is a hemoglobin A1C level of less than 7, systolic blood pressure less than 130, and LDL or the bad cholesterol less than 100.
19% of the patients in the medical group met goal. In the surgical group, it was 49% of those 60 patients that met goal.
Researchers say glycemic control was most pronounced in the surgical group. However, balancing the benefits and potential risks of surgery always needs to be addressed.
We've got a robust treatment, and I think that for the appropriate patient, we can really make a difference at 1 year in patients that otherwise could not reach goal.
Catherine Dolph, The JAMA Report.
Hi, I'm Dr. Laura Schwaluk. I specialize in preventing and reversing type 2 diabetes. A question you should ask any practitioner you are thinking of working with is, do you have specialized training in functional medicine? Functional medicine deals primarily with prevention and underlying root causes of chronic disease, rather than simply removing or masking symptoms once they arise. Functional medicine emphasizes true healing, treatment of the person rather than a disease, and a partnership of joint responsibility between the doctor and patient, with the patient carrying most of the load in being proactive about their health. It also embraces the most current science in diagnosing early abnormalities that eventually lead to chronic disease, such as type 2 diabetes, hypothyroidism, gastrointestinal issues, and autoimmune disorders. Functional medicine uses botanicals and other forms of nutritional supplementation to help you heal, rather than pharmaceutical agents that create high levels of stress damage. Under the influence of functional medicine, old age is not what it used to be. Anti-aging is now a science, and optimized health is the new normal for people of any age. If the person you are considering working with does not work with functional medicine, I encourage you to explore other options of care. Please contact my office or visit the website listed below to set up your consultation. Thank you.